3, 2, 1.
Yep.
Hand sanitizer. Hi, my name is Julie. I'm going to be your nurse today. Can I have you tell me your name?
LW.
Perfect. And your date of birth?
11/6/97.
Perfect. Thank you so much. All right, LW. I'm going to be doing an assessment on you today, and we are going to start off with a set of vital signs. So first, I'm just going to put a blood pressure cuff on your arm here. If I could have you slip one of your arms out. I can get this pulled up. Perfect. All right, I'm going to go ahead and put this blood pressure cuff on you now. Wonderful. And I'm going to go ahead and put my fingers on your wrist. If you could go ahead and flip your hand over. Mm-hmm. 122/78. Wonderful. And go ahead and take this off now. Thank you. All right, next I'm going to go ahead and I'm going to check your pulse by putting my finger on your wrist, okay? Perfect. Your heart rate was 84 and you had 18 respirations per minute. All right, now what I'm going to do is we're going to move on to a neck vessel exam. So I'm going to have you take off that gown or open it up in the front if you could. Perfect. And I'm just going to have you lean your head back so I can visualize your jugular veins. And I'm looking for jugular vein distension. All right, no jugular vein distension noted in an upright position. Now what I'm going to do is I'm going to assess your carotid arteries here. So I'm going to go ahead and put my fingers on each side of your throat, okay?
Mm-hmm.
Good. I feel a moderate contour of your neck, regular rate and rhythm bilaterally. Now what I'm going to go ahead and do is I'm going to listen to your carotid arteries. And I'm going to listen in 3 spots and I'm going to give you instructions to exhale and hold your breath, okay?
Mm-hmm.
So I'm going to start on the left side. Go ahead and sit normally. Go ahead and exhale and hold. Breathe. Exhale, hold. Breathe. Exhale, hold. Good. Breathe. I'm going to put on the other side now. Exhale, hold. Breathe. Exhale, hold. Breathe. Exhale, hold. Breathe. Good. No swishing or brewy sounds were heard. Now what I'm going to do is I'm going to have you kind of lean down in the chair here as I assess your precordium. So you can go ahead and put your legs up on the chair and lean back for me. All right, and I'm just going to have you open up the gown a little bit more here. Perfect. Thank you. Go ahead and lean back. And I'm just going to assess your chest for heaves, lifts, or pulsations. None are noted. Now what I'm going to do is I'm going to go ahead and palpate your apical pulse, which is on your 5th midclavicular line here in the 5th intercostal space. So, and I will have you lean to the left a little bit just so I can get a good feel. Good. And feel short, quick, gentle taps. Wonderful. You can go ahead and lean normally now. Now I'm going to go ahead and I'm going to listen in that same spot. Listen to your apical pulse. Good. Regular rate and rhythm. Now this is exactly where I'm going to start listening for your heart exam. So I'm going to be listening to the mitral valve, which is on that midclavicular line, 5th intercostal space, and I'm just going to listen to S1 and S2 here. Good. S1 and S2 are heard. Now I'm going to move up to the left sternal border, to the tricuspid valve. Good. Now I'm going to move up to the 2nd left inner space here for your pulmonic. S1 and S2 is heard. Now I'm going to move to the 2nd right interspace for your aortic. Good. S1 and S2 is heard. Now what I'm going to do is I'm going to listen in those same spots again with the bell of my stethoscope. So we'll start off at that mitral in the 5th midclavicular space. Move up to the left sternal border for the tricuspid. Second left inner space for pulmonic. 2nd right inner space for aortic. Good. I did not hear any extra heart sounds such as S3 or S4 or murmurs. So now I'm going to move on to the respiratory exam. First, I'm just going to start off by inspecting. I'm just going to have you breathe normally, and I'm going to watch for use of any accessory muscles here. It appears that your breathing is easy and unlabored. Good. Now I'm going to actually have you sit up, so I go ahead and put your feet down on the ground here. Go ahead and sit up. Perfect. All right, and I'm actually going to put my hands on your chest, and I'm going to have you take a deep breath in and out. Good. Equal chest expansion, equal hand symmetry. Now what I'm going to do is I'm going to put my hands on your chest a few times, and when I do that, I want you to say the term 99, okay? All right, if you could sit up a little bit more, perfect. All right, go ahead.
99, 99, 99, 99.
Good. Tactile femtus vibrations were heard equally bilaterally. Now what I'm going to do is I'm going to go ahead and I'm going to percuss or tap in a few different spots across your chest, okay? Good. I heard a clear, hollow resonance. Now what I'm going to do is I'm going to go ahead and I'm going to listen to your breath sounds, okay? So each time that you feel the stethoscope touch your skin, go ahead and take a nice deep breath. If you do feel dizzy or lightheaded at all, just let me know and we can take a break, okay? All right, so go ahead and take a nice breath. Good. Take a breath. Clear breath sounds in all lung fields, no adventitious breath sounds at all here. Perfect. Now I'm going to move on to the back here, and I'm actually just going to have you flip body so that you're seated here and facing that direction. Perfect. Once again, I'm just going to watch as you breathe and watch for use of any accessory muscles. Again, your breathing appears to be unlabored and easy and even. I'm gonna go ahead and I'm gonna put my hands on your back again, and I want you to take a nice deep breath, okay? Good. Equal chest expansion, as demonstrated by my fingers kind of moving apart at the same time. Now what I'm gonna do is I'm gonna put my hands on your back again, and when I do, I want you to say the number 99 again, okay?
99, 99, 99, 99, 99.
Good. I heard vibrations of tactile fremitus, equal bilaterally. Sorry about that, my hands are a little bit cold. Now what I'm going to do is I'm just gonna rub my hands down your back to check for masses, lumps, and bumps. I want you to tell me if there's any areas of tenderness at all, okay? Any tenderness?
Nope.
Okay. Now I'm gonna go ahead and I'm gonna percuss or tap again. Just listen to the sounds that come out. Oops, sorry. Good. Clear, hollow resonance, indicative of healthy lung tissue. Now what I'm going to do is I'm going to go ahead and I'm going to listen to your breath sounds again. So whenever you feel the stethoscope, go ahead and take a nice deep breath for me, okay?
Mm-hmm.
Alright. Clear vesicular breath sounds heard, no adventitious noises. Doing okay? Are you feeling dizzy or lightheaded at all?
Nope.
Okay. I'm actually going to go ahead and have you sit back where you were before. And I'm just going to move this out of the way here. Perfect. Alright, so now I'm going to do a peripheral vascular assessment. So first, I'm just going to take a quick peek at your arms here, and I'm going to look at the equal hair distribution. I'm going to see that your skin is nice, warm, pink colored. No cyanosis is noted. Now what I'm going to do is I'm going to have you bring one of your hands up to chest level here, and I'm going to squeeze one of your fingers and check your capillary refill. Good, that was within 2 seconds, which is perfect. Now what I'm going to do is I'm going to check your radial pulses, okay? Now as I do this, I'm also making note that your skin is warm and dry. Good, regular rate and rhythm, 2+ in strength. Now I'm going to move up to your brachial pulse here. Good, regular rate and rhythm, 2+ in strength. Now I'm going to move down to your lower extremities. Again, I know that your skin looks pinkish in color, no cyanosis that I note. There's equal hair distribution, no lesions or ulcers are noted. All right, now what I'm going to do is I'm going to put my fingers on the top of your toes and check your dorsalis pedis pulses. Perfect. Good, regular rate and rhythm, 2+ strength bilaterally. Now I'm going to move on to your posterior tibial pulses, which are back in here. Good, regular rate and rhythm, 2+ strength bilaterally. All right, LW, that concludes our assessment today. You can let us know if you have any questions or concerns, and I hope you have a great rest of your day.
You too.
I'm
Thank you.
going to hand sanitizer on my way out.